Good morning, ma'am. I am Nurse Calpo, your assigned nurse for today, and I am here with you to explain the condition of the patient and why the patient need to undergo surgery. So, ma'am, the condition of the patient is massive bleeding, multiple fractures secondary to vehicular accident. Lumbar spine fractures are often a result of significant blunt trauma, such as motor vehicle accidents or a fall from height. The primary symptom of lumbar spine, ma'am, is a moderate to severe back pain that worsens with movement. Bone repair or bone fracture repair is done when a broken bone doesn't or wouldn't heal properly with casting or splinting alone. Improper healing that requires ORIF surgery can occur in cases when the bone is sticking through the skin, or what we call the compound fractures, and fractures that involve joints such as wrist and ankles. So, what are the interventions of management during this surgery, or the pre and post intervention? So we need to anticipate that patient may also experience severe bleeding, and the preoperative on bleeding or the management of preoperative bleeding consists of identifying patients at risk, understanding the impact of the operation on hemostasis, institution of allogenic blood, and factor concentrate-based therapies, utilizing point-of-care laboratory testing, and understanding the limitation of monitoring techniques. And also, we have to need, there's a need for us to understand or to know the interventions of post-operative on bleeding. How is post-operative bleeding is treated? So, a blood transfusion may be done to give you a donated blood through an IV. So, expect that the patient that may receive or may have blood transfusion through IV, and blood components may be given during a transfusion to help stop your bleeding. Blood components are the part of blood that help it to clot. Examples are clotting factors, platelets, and plasma. Antifibrinolytic medicines may all slow or stop your bleeding, and this may also be given to the client. And surgery may be done to fix also the blood vessels or area that is bleeding. So that's all, ma'am. I hope that I explained well the pre and post operative interventions or the management, and why there's a need for the patient to undergo such that kind of surgery. And thank you, ma'am, for sharing your time with me and for listening for my explanation. And thank you so much po.